after discussing about the first degree and second degree AV block, now we are going to discuss about the third degree AV block. Now third degree AV block is also known as complete heart block. Okay, so here your AV node is not functioning at all. Okay, so the impulses coming from the SA won't be conveyed to the ventricle down there. Fine. So SA is generating impulse, but it is not getting conveyed to the ventricle. So SA will keep doing its works because it's a main pacemaker. Now AV is blocked, but ventricle has to beat. So somewhere from the bundle of His, or the bundle, left bundle or the right bundle, or the ventricular muscle itself, somewhere depending on the level of block, someone has to take over the function for the ventricle. Okay, and that will pace the ventricle constantly. Fine. So what we understood here is when AV is completely blocked, SA will work independently for the atria contraction. SA will work independently for atria contraction, while below the AV some fiber or some pacemaker will take over for the ventricle contraction. Now both the pacemakers are not related to each other, they are independent things. Fine. So here we can understand the atria and ventricle are contracting independently but regularly. Okay, so you have constant SA production which gives you the P wave through the atrial depolarization. So at a constant rate in a ECG you will get the P waves. Fine. So at the constant rate, suppose this is the one P wave started, after that interval one more P, same interval one more P, so P will be going on here. So this is the P waves we can see here almost at the same interval which is going through this ECG paper and giving you the atrial depolarization. Now this P actually was supposed to be followed by QRS all the time if my AV node would have been intact, but now AV node is totally screwed up. So what happens is below that somewhere something takes over and creates your ventricular depolarization. But remember, SA node is the main pacemaker because it generates the impulse at maximum speed. Okay, so if someone from the below the AV node is taking over, it is going to generate impulse definitely at the lower speed than the SA node. So what we understand here, the ventricular depolarization or the QRS complexes will be at lower speed than the P waves. Fine. Okay, but what we know, it is independent. SA and the below pacemaker is independent because AV is blocked. Okay, so suppose the new pacemaker has generated a QRS complex. Okay, so this is one. Now at one regular interval one more QRS will come, at one more at same interval one more QRS will come. Okay, now what we can see here is the P is happening regularly, the QRS is occurring regularly, and there is no correlation between P and QRS. Okay, so when in a ECG you have P and QRS both at the regular rate, P at the regular rate, QRS at the regular rate, but there is no relationship between the P and QRS, that is complete heart block. Okay, so we understood here. We'll see with the real example of the ECG, then it will be little easy to get what is the complete heart block.